Hello everybody. Today we will talk about the bone and the joints of the upper limb. So first of all, we will divide the upper limb into two kinds of bones. So number one is the girdle bone, clavicle and the scapula. The special feature of these two bones that touch the trunk. And then we will talk about move freely, about the arm, forearm and hand, the bones. Okay, now we clarify one by one. First of all, I will show you the clavicle bone. So clavicle bone, we will find it has two extremities. It's a sternal ending and a acromion ending. This articular surface is joined to the sternal bone, so we call it sternoclavicle joints. And another ending is acromion. So acromion formed the scapular acromion, so they get together. Acromion clavicle joint. It's S-shaped long bone. So S convex forward, it's on the medial side, and backward, it's on the lateral side. Then sternal ending always on the medial side, and acromion always on the lateral side. So its positions look like this. So it's the right clavicle. Look at this bone. Yes, it looks a triangle. So we have three angle and three border and two surface. The anterior surface is smooth from the subscapular fossa because we know it's a subscapularis muscle located inside. And on the posterior surface, we have the one spine. So the spine divides the posterior surface two portions, superior spinal fossa and inferior spinal fossa. Then the spinal ending, that's we call the acromion. So now we look at the three border. So this is the superior border. We have the superior scapular notch. And this one is the medial border. So medial border opposite to the vertebral column. So vertebral column and scapula. So between this area, the doctor can do the physical examination, can hear the breath. So that's we call the auscultation triangle. Then we find we have three angles. This is superior angle, this is the lateral angle, and this is the inferior angle. So why I call it lateral angle? Because the glenoid cavity forms the shoulder joint for the humeral head. So always on the lateral side. So that's we call the glenoid cavity. Now continue looking at this cavity. Above we have the superior glenoid tubercle and the inferior glenoid tubercle. Superior glenoid tubercle is very important because the long tendon of biceps just touched here. Then above it, that's we call glenoid plexus. So we just finished the girdle bone. Now we will talk about the free bone of the upper limb. So free bone of the upper limb, so we divide the three parts, okay. Arm, forearm, and hand. So one by one. So number one, formed this long bone. We have two extremities and one trunk. So this is the humerus. Upper extremity we already know. It's the head of the humerus. So it's the glenoid cavity form the shoulder joint. We have two tubercles, major tuberosity and lesser tuberosity, and between it, so we had intertubular grooves. So this groove is also called the biceps groove because biceps long tendon pass through it. We find the neck. So the neck here we divide two kinds. Number one, articular surface. Body. So this one is an anatomical neck. Number two is a narrow part, head and neck, easily broken. So that's we call the surgical neck. So be careful. By the way, the neck, the axillary nerve always round the neck to support the deltoid muscle. Then we're looking down. Posterior portion, so we find it's the radial nerve sulcus. Radial nerve sulcus in the middle point, posterior portion. So what it means? It means that the radial nerve just passes through here. We look at the lower extremity. Lower extremity, we have two articular surface. So this one is the trochlear, and this one is the capillary. Above is the fossa, okay, clinoid fossa, and posterior side it's the auriculum fossa. So auriculum fossa just formed the ulnar bone. This must be anterior and this must be posterior. So very special features we will find on the medial side. We have the one groove, it's the ulnar nerve groove, so it's here. Then we have 2 points. We can easily feel elbow joint, these two. That's what we call epicondyle. So we finished the bone of the arm. So now let's look at the bone of the forearm. Okay, forearm rotation. So rotation bone we have two. They get together and they move together. So this one is the ulnar bone and this one is the radial bone. So they get together, form the two joints. This one is the proximal radial ulnar joint and the distal radial ulnar joint. Okay, radial bone first. So radial bone we will find the head, the neck, and the tuberosity. So this tuberosity is the incision of the biceps. Another point is the low point and inferior surface, the articular surface. So it's formed the wrist joint. And the superior part is the surround articular surface. So just joint to the ulnar bone radial notch. So now we look at the ulnar bone. So it's also divided 3 parts: superior extremity, lower extremity, and the trunk. So superior extremity a little bit complicated. So one by one, number 1 look like the mouth of the eagle. That's we call the auriculum. And trochlear nerve and cricoid process. So now we just linked it to the humeral bone. See? Humeral bone. So trochlear and trochlear notch, they get together. Ocular fossa and clinoid fossa, so they can get together. When we extension elbow joint, we look at here, so we will find the lateral epicondyle, medial epicondyle, and auriculum. They just keep one line. And when we flexion the elbow joint, so they form the triangle, these 3 points. So if elbow joint dislocation, so these 3 points position would be changed. So now we will talk about the joint. So the elbow joint a little bit complicated. This one is elbow joint. So elbow joint actually divides 3 joints: humeral-ulnar joints and humeral-radial joints and proximal radial-ulnar joints. Elbow joint is a dislocation, especially for the child, because we know this is surround for the radial head and the ulnar bone of the radial notch. So it's a very easy dislocation. We just have only one ligament to support it. So look like this. That's what we call the annular ligament. So if the baby fall on the ground, we just hold the arm. Be careful, hold the arm. See? So the radial-ulnar joints easy dislocation. So the baby will feel pain, always crying. So sometimes be careful, maybe dislocation for the distal radial-ulnar joints. Okay? So someone would ask me how to hold the baby. So be careful, just hold the trunk, not always hold the hand. So we just finished the girdle bone, arm, and forearm bone. So now we talk about the bone of the hands. So now we look at the hand bones of the hand. So the bones of the hand we divide 3 kinds. So from the wrist joint and to the fingers. So one by one. So this is the carpal bone. It's a short bone. Totally we have 8. And metacarpal bone. So 1, 2, 3, 4, 5. So we have 5 metacarpal bone. And then we just look at the pharyngeal bone, pharynx. So pharynx, so we divide the thumb, the index, middle finger, and the ring finger, and the little finger. So be careful. The rest 4 always the distal, middle, and proximal. 3 pharyngeal bone. And for the thumb, only 2. Okay. So now we just clarify the carpal bone, the 8. So the 8. So be careful. We will find divide 2 rows. So we have the proximal row and the distal row. So 4. The position we will find from the lateral side to the medial side. So I will show you one by one. Scaphoid, lunate, and tracheal, and pisiform. Okay, pisiform. So we have 4. If we look at carefully, so we will find 3 carpal bone. We have the articular surface, so they form the radiocarpal joint. So it's trapezium, trapezium, capitate, and hamate. Okay, hamate also called the hook bone. See, look at hook. So it's formed the carpal tunnel, carpal groove, carpal tunnel. The medial nerve just pass through in the medial side of the hand. They formed the joints of the intercarpal joints. Then they joined together for the metacarpal bone. So we call the carpal metacarpal joints. Metacarpal, they get together. They call them the intermetacarpal joints. And the metacarpal pharyngeal joints. And the interpharyngeal joints. Interpharyngeal joints divide 2 kinds. Proximal interpharyngeal joints and the distal interpharyngeal joints. Anybody can tell me the pharyngeal bone, long bone, short bone, or flat bone, or irregular bone? Yes, the answer is long bone. Although the pharyngeal bone is very shorter, but it always have distal extremity, proximal extremity, and trunk. So we call it long bone. Thank you.